Your question, the member from Brampton Springdale.
Thank you, Mr. Speaker. Mr. Speaker, my question is for the Associate Minister of Health and Long-Term Care. Minister, as we all know, the number of Ontario seniors aged 65 and over is projected to more than double to over 4.5 million, or 25% of the population by 2041. And with that growth, we know the increasing number of our parents and grandparents may one day require specialized care provided by one of the province's long-term care facilities. Mr. Speaker, we also know that this demand for long-term care increases. Organizations like the Ontario Long-Term Care Association are telling us the number of long-term care residents coming into care with cognitive impairments have increased significantly, with more than 60% of the residents in our long-term care homes currently having Alzheimer's or some other form of dementia. And as more and more families in my riding are turning their thoughts towards care of their parents and grandparents in the future, I would like to reassure them that their loved ones will continue the highest level of care. So, Minister, can you please tell this House about the new funding and how it will be used to provide the highest level of care for our loved ones?
Minister of Health, Long-Term Care.
Thank you, Mr. Speaker, and let me begin by thanking the member from Brampton Springdale for this important question and her ongoing advocacy for seniors in her riding. Mr. Speaker, the member is absolutely right. Over the last decade, we have seen an increase in the instances of people with dementia entering long-term care, exhibiting what are called responsive behaviors, such as aggression, wandering, and agitation. And that's why, Mr. Speaker, long-term care is one of the areas that the Ministry of Health has consistently been increasing funding, Mr. Speaker, and this year is no exception. In fact, Mr. Speaker, this year we are providing exceptional funding to the long-term care sector, including a 2% increase across the board to every single long-term care home in Ontario for their personal care needs, of residents. But more importantly, Mr. Speaker, we are also increasing our investment in behavioral supports Ontario by $10 million. And I have to say this, Mr. Speaker, if the opposition is really serious about...
No, you don't. Supplementary.
Thank you, Mr. Speaker. Minister, that's wonderful news. The residents of my riding, I'm sure, will be happy to know how important a priority the safety of our loved ones is for you and for your ministry. But Minister, I know you're responsible for the wellness of Ontarians, and I know that making Ontario smoke-free is a goal that you're quite passionate about. I know smoking prevalence has decreased from 24.5% in 2000 to 17.4% in 2014, representing 408,000 fewer smokers. And as a member of this government, I'm proud to say that Ontario has the third lowest smoking rate in the country. But Mr. Speaker, the use of tobacco products remains the leading cause of preventable disease and death in Ontario. More than 2 million Ontarians still smoke, and thousands of youth still take up smoking every year. So through you, Mr. Speaker, can the Minister tell this House what our government announced in the budget last week to help us continue striving towards the goal of Ontario achieving the lowest smoking rate in the country?
Thank you, Minister.
Thank you, Speaker, and again I want to thank the member for the question. And as the Minister responsible for health and wellness in Ontario, I'm very proud to continue the legacy of protecting Ontarians, especially young Ontarians, from the harmful effects of tobacco. And that's why, Mr. Speaker, I am so pleased to announce to this House that we're going to increase funding for smoking cessation by $5 million if this budget is passed. So, Mr. Speaker, whether it's long-term care, whether it's health promotion, this government is increasing funding, and this is what I have to say to the opposition, Mr. Speaker. If they are really serious about supporting our seniors, instead of asking sanctimonious questions in this House, I would ask that they stand up and support this budget, because, Mr. Speaker, talk is cheap, but they have the opportunity to really support seniors by standing up for this budget. Thank you, Mr. Speaker.
Thank you.